My name is Dr. Trent Twitero. I'm an orthopedic surgeon. I have been a doctor for 30 years now. I've been an orthopedic surgeon for 21 of those years, and I've been here at Seguin for 14 of those years. Originally from South Dakota and part of a small contingent of South Dakotans that have ended up here in Seguin. I began getting a biology degree at the University of North Dakota and then was accepted to the Uniformed Services University in Bethesda, Maryland, where I was on active duty in the Army, got my medical degree. Spent several years as a general practitioner in the Army and then took an orthopedic residency at Brooke Army Medical Center back when it was still called BAMC. I chose Seguin, Texas as I was getting out of the Army, and I started casting my nets looking for a place to go into my next stage of practice, and was very familiar with this area from training in San Antonio. Had many friends that lived out in this direction, and they all kept convincing me to come look at Seguin, look at Guadalupe Regional Hospital, and the staff here was amazing, the facility was amazing, the support was amazing, and they invited me in with open arms, and I've enjoyed it ever since. The first consultation with me, of course, like every physician's office in the country, is going to have a little bureaucracy and paperwork, so everyone should always be prepared for that, no matter where you go. The first visit is always a little bit of getting to know each other and learning some of those background things about each other, and again, helping to then decide what treatment plans might be best for them. But I also like to look back at the fact that the root word of physician comes from the word teacher. And so I'm always going to do my best to explain to people what their condition means and explain to them what the different treatment options mean and basically teach them how to manage their condition and why we're thinking what we're doing instead of just saying, we're going to do this, get out of my office. Some signs that I think people should recognize to come see an orthopedist. One, if it stops you, whatever that pain or problem happens to be, if it's stopping you from doing your work and taking care of your family, you probably ought to come see one of us. If it stops you from doing the things that you really enjoy in life, if your greatest joy in life is riding horses and you can't ride your horse, come see me. Life is short. Or thirdly, and I think also a no-brainer, if it's waking you up at night and you can't sleep because you're having too much pain or trouble with a body part, then please come see us.